3 keys to understanding TRT and testosterone levels. The video addresses some fundamental points about testosterone replacement therapy TRT. First, the lack of clear tables showing normal free testosterone levels by age is discussed.
Okay, so let's go back to kind of TRT then. So we've kind of established what's going on.
When are you starting?
Yeah, we're going to talk about that. I'm actually doing my blood again next week, so we'll see how far my levels have continued to.
Making it difficult for many to understand their laboratory results. Second, it explains how most of the testosterone in the body is bound to proteins such as globulin and albumin, leaving only a small percentage as free testosterone.
Fall. So I was going to actually talk right about that, right? Which is, let's talk about quote unquote what's normal.
Mm-hmm.
So I've never found a compelling table for normal levels of free testosterone that are stratified by age. So you can.
Finally, the importance of understanding that free testosterone measurements are estimates, not exact calculations, is emphasized, which can lead to confusion when interpreting the results. These points are crucial for anyone considering or already on TRT.
Find these data quite easily for total testosterone level. Mm-hmm. But I've only really seen data for broad chunks, prepubescent, pubescent, post-pubescent. Yeah. Here are the percentile ranks for free testosterone, whereas for total, I can show you by decade or something like that. I guess it's worth putting some context to this, right? So if a person's total testosterone is